Hi, I wanted to talk to you today about vaccinations and disease. So, first, let's talk a little bit about vaccinations. So, a vaccination is an injection of a weakened form of a pathogen or of a similar but less dangerous pathogen to produce immunity. So, basically, what's going on with a vaccination is that we're introducing antigens into your body. And your immune system will see those antigens and they'll say, oh, this doesn't belong here. And they'll make antibodies to fight off the antigens. And then your immune system produces memory cells. So they remember what that antigen looks like. And so if it ever is reintroduced into your body is now ready to have a quick response. Okay, so if you're exposed to that pathogen, your body can fight it off quickly. Right now, I want to talk a little bit about what's the difference between a vaccine and an antibiotic. So, the first thing we need to know is that vaccines are helping to produce an immunity to a pathogen. Okay, it's helping your body to be immune. Okay, and you can have vaccines for both viral and bacterial pathogens. Some examples of viral vaccines: measles, your MMR. If you're vaccinated, you got your MMR when you were young. Okay, chickenpox, the flu, those are all viral vaccines. Some of the bacterial vaccines that you may have gotten: tuberculosis, whooping cough, tetanus. Those are all caused by bacterial infections, and you can be vaccinated to prevent those diseases. That's another big word right there that I want you to remember, is that vaccines are used as a prevention. It's going to help keep you from getting sick from that pathogen. Now let's talk a little bit about antibiotics now. So antibiotics are blocking the growth and reproduction of bacterial diseases. And they're used as a treatment. So when you get infected with different bacteria, okay, you can take an antibiotic, and that antibiotic is going to stop that bacteria from growing and reproducing. And over time, then that antibiotic will clear out the bacteria that's in your body. So it's used as a treatment once you're already infected. And just another reminder, this does not work on viruses. Antibiotics do not treat viruses. Okay. Another reminder, I cannot say it enough. And one of the reasons why we really stress this is because of antibiotic resistance. So this has been a problem because of the misuse of antibiotics. So sometimes that misuse has to do with people going in and requesting antibiotics when what they really have is a viral infection, like a cold. Hey, you can't take antibiotics for a cold. It won't do anything. The other issue with antibiotic resistance is that people sometimes don't use their antibiotic correctly. And what I mean by that is, if you're given 14 days of an antibiotic, it's super important that you take all 14 days. Even if after 7 days, I'm feeling great, I don't feel sick anymore, okay, you should not stop taking it. Because what might happen is that you might have some bacteria in your body that is resistant to the antibiotic that you take. Okay, so if you stop taking it early, you might still have some bacteria alive. Okay, the ones that are alive are going to be the strongest. Okay, and if those strong resistant bacteria are still alive, they're now going to reproduce. Okay, and the offspring of those resistant bacteria might also inherit that resistance. And so what can happen then is that you can have this now population of resistant bacteria, okay, that's now in your system. Okay, and if you go and try to then take the antibiotics to fight off that, it's going to be more and more difficult to clear up that infection because the antibiotic that you are taking might no longer work. Here's an example of this. So on those discs, on the white discs, there is an antibiotic. The plate on the left side shows normal bacteria, and you can see that all of those discs work to help prevent the bacteria from growing. And we can tell because there's a clear zone of no growth around each disc. Now, if you look on the right side, that is the same type of bacteria, but it's a resistant strain, which means that strain of bacteria has now developed a resistance to, it looks like, 3 of those antibiotics. So if you try to take an antibiotic, okay, it might not work against that strain. Okay, there's fewer antibiotics now that would be effective in fighting off that bacteria if you were infected with a resistant strain. Next, I want to talk about herd immunity. This is a term that you've probably heard in the news lately. And what it means is that you have an indirect protection from infectious disease when the majority of people are immune. So if you look at these two images here, on the left, we have an image that shows what if only some people in a community are vaccinated. So the vaccinated individuals are in yellow. Blue are individuals that are healthy but not vaccinated. And then the person in red is not vaccinated and is sick and contagious. So if most of the people in the community are not vaccinated, a virus can spread pretty quickly and infect a lot of people. Okay. However, if most people in a community are vaccinated, you can see everybody in yellow here are now vaccinated, and a sick, unvaccinated individual exposes them. Okay. They're not going to spread it around. Okay, because they're not vaccinated and they're protected, they're not going to spread it around as much to the people who are not vaccinated. Yes, some of those unvaccinated people might get sick, okay, but you can see the other individuals are protected. Okay, so this is really important because it helps prevent outbreaks from happening, and it protects individuals that cannot be vaccinated. So newborn babies. When you're a little baby, you can't get your vaccines until you hit certain ages. There's a vaccine schedule. And so if they're not vaccinated for something yet, okay, having this herd immunity is really going to keep them the safest. There are also some individuals that have severe allergies that can't get vaccinated. So they really do rely on people around them to keep them safe. And we do have a lot of cases of times when the number of people that have been vaccinated drops in a community, and then we start to see outbreaks of diseases that we shouldn't be seeing outbreaks of anymore. And the one that we've been seeing a lot of lately is the measles. So like back in 2014, there was a measles outbreak in an Amish community in Ohio. Okay, they had a really low vaccination rate. And because of that, the measles entered the community and it spread. And like almost 400 people got the measles. Okay, this happened in Disneyland in 2015. Somebody came in with the measles and it spread in Disneyland, and like 125 people got the measles. Okay. And that's all because the number of children that were getting vaccinated for measles decreased at that time. Even back in 2017, we had a measles outbreak here in Minnesota, and around 75 people got measles. Okay, measles is a very easily prevented disease, and yet we're starting to see more and more of these outbreaks because not enough people are getting vaccinated for it. There'll be a little bit more information about this in the video that you're going to be watching soon. The next thing, and the last thing I want to talk about is emerging diseases. Okay, there's two types of emerging diseases. We have new diseases and we have re-emerging diseases. New diseases are when we have like human encroachment on animal habitats and we have exotic animal trade. Okay, so humans are now coming into contact with wild organisms and animals that they normally don't come into contact with. And because of that close contact, you can have viruses that hop over and then start to infect humans. Some examples of this, we have monkeypox. Right? I don't know if you've heard of monkeypox, but it was around in like the 1970s, and humans got it because of their close contact with some small mammals. SARS is another example. SARS is severe acute respiratory syndrome that causes pneumonia. And there was an outbreak of SARS in 2003. And COVID. COVID is a new disease, right? Also, they believe came from this like close contact with animals. COVID is a type of SARS. Okay. There's some other new ones. MERS is one you might have heard about from 2012. So there's lots of new diseases that are coming around. Reemerging diseases are a little different. This is when we start to see diseases coming back that have been gone. Okay, and this has to do a lot with the misuse of medication. Okay, so an example of that would be the antibiotic resistant tuberculosis. We now have strains of tuberculosis that can't be treated. Okay, measles is another example. Right, measles are coming back because we're getting higher numbers of people that are not vaccinating for measles. Now that you're done watching this video, make sure that you have your notes completed in your Google Doc. If you have any questions or comments about the things you just learned about, there is a spot in the document where you can include those questions.